Well, Fox News Channel just getting new details from our Capitol Hill sources on the next step in the health care overhaul. Some key Democrats suggesting steps are quietly getting underway to pass the current health care bill with just 51 votes in the Senate, a process known as reconciliation. It may be harder than it sounds, but we have to ask, if that is the plan, why the big health care summit later this month? Joining us now, New York Congressman Anthony Weiner, a Democrat. Congressman, thanks so much for being here.
TV is because CNN was on? Is that what was going on?
What? Yeah, exactly. He's not a fan. We'll get to the bottom of that in Kelly's court. Okay, so supposedly there's going to be this big summit. It's a bipartisan thing. It's a kumbaya moment. Yeah. But now we get word out of Nancy Pelosi that, indeed, reconciliation is a viable option, and they're taking a hard look at it, and it may, in fact, go forward this way. So why bother with the summit? Well,
because reconciliation, all that really means in layman's terms is a majority rule. You know, 51 people vote in the Senate. It's a 100-vote body. That's the way it should have been all the way along. That's the way it's been in American history. The summit, look, I'm kind of with you in that I'm not sure what the summit is supposed to do. The Republicans have already said we're not interested in having any health care bill for the president. This is going to be his Waterloo. I think they're there, frankly, just for show as much as the president is there for having.
Well, they have to go now that they've been invited, right? I mean, you got.
I don't know. I've heard back and forth. You know, we want it to be televised. We don't want it to be televised. Look, fact of the matter is, Republicans have made it very clear they're not really interested in dealing with this problem in a serious way. We saw it all throughout this process. Not a single one of them has come to the table and said, if you do A, B, or C, I'll vote for the bill. Not a single one.
Well, because they don't like the bill. They have their own ideas. And in their defense, the American people don't appear to like the bill. We have the latest poll from ABC News and Washington Post that shows 59% say that the proposed changes in this bill are just too expensive right now. It's not time. It's not time for this.
First of all, the proposed bill by the House and the Senate save money. So just immediately when you're asking whether it's too...
They don't believe that.
Yeah, but hold on a second. The fact of the matter is there's not a bill yet. And I agree 100% with the idea that this has all gotten, and we've talked about it, too much of the focus on the sausage making, trying to get 60 votes. People have lost sight of what we're trying to do here. But the fact is, when you break it into its individual parts, do we want to prevent health insurance companies from abusing our rights? Almost 100% of people say yes to that. The public option, something like Medicare to a competition for health insurance companies, neally 70% support that.
But you can't
so a lot of the elements...
How can you break it into its individual parts? Because people are looking at the whole massive thing saying $500 billion worth of cuts to Medicare. I'm worried about that. I don't believe in the savings. Where's the tort reform? They're looking at the whole monster
well, hold on,
saying,
I
don't like it.
I'm not sure I believe that. I think that what we've seen over the course of the last several months is this has gotten more complicated and more confusing each and every day. We've had more focus on Ben Nelson's deal than we really had on the good things that are in the bill. You know, the fact is that we do need to lengthen Medicare's life. The bill does it. We do need to save over $170 billion. The bill does it. We do need to cap costs. The bill does it. We do need to do things like tort reform. So, for example, in the bill, and you might not even know this, in the bill, in order for you to bring a tort claim under health care, you have to show that a doctor, an independent doctor, believes that you have a legitimate case. We do that in the bill. When people understand the bill, they support it. But I agree with you. This has gotten off the tracks. We need to refocus it on what's simple.
But you know, I think a lot of our viewers listening to you right now might be saying to themselves, there he goes again with this Democratic message of, oh, we dumb folk just don't get it. You know, like the lawmakers, they get it, and they keep saying, if the dumb folks out there could just let me explain it to them, then they'd be on board.
No,
the viewers will write in and say, we get it, we just don't like it.
No. The problem, I'm not blaming anyone else. I'm saying that this process has become so complicated and convoluted that, let's face it, we've been on talking about Olympia Snowe and Ben Nelson and what deal that they're making that we've lost sight of the fact of what we're trying to accomplish here. It's not the American people's fault, it's our fault. That's why I think what we should be doing is, rather than having these summits with people who frankly are never going to vote for this bill, and I mean my Republican friends, we should be out there talking about what's in this bill and trying to get it right. Taking things like the public option, which when you explain it to people like it. Competition, choice, lower cost, what people like.
Aren't you worried about the 2010 midterm elections and in the wake of what happened in Virginia and in New Jersey and most recently in Massachusetts, where the Republicans argue a message has been sent? Aren't you worried if you shove this thing through, or as they're saying, muscle it through with reconciliation, 51 votes instead of the 60 in the Senate, you're going to pay a price at the polls?
We believe, and American people believe, in majority rule. That's what it's 51. Muscle it through. Do you know how long we've been going through this process?
This is such a huge portion of the American economy.
That's exactly right, which is why we can't do nothing. The alternative is to do nothing.
But do something, but not the bill that the people don't like, according to the polls.
Well, hold on a second. We're getting back to this point. I would agree with you. We do need to package this and to explain it a heck of a lot better than we've been doing. Doing nothing means continuing to hemorrhage jobs. Doing nothing means 17,000 people every day lose their health insurance, and you and I pay for them when they go into hospital emergency rooms. Doing nothing means $300 billion of deficits in the states. 20% of it is health care.
They're
we
after
can't
me,
do
but
nothing.
I got to ask you this before I let you go. Okay, so why not scrap the bill, which again the polls say the majority of Americans want that to happen. Scrap that bill, start anew. Go to this summit, open-minded, listen to what the Republicans say, they listen to what you say, maybe you come up with something
You know who loves
better.
that idea? The health insurance industry. The top 6 health insurance companies have had record profits. Why? Because we've done nothing to control costs for people who are paying taxes and buying insurance. We can't let that happen anymore. The Republicans did that for 8 years. Time for action is now.
All right, Congressman Weiner, it's always a pleasure having you here.
My pleasure. Thank you.
He was our inaugural guest here on America Live, so he's got a special place in our heart. Thank you so much, sir.
Thanks.